and exhaling. Beautiful. If you're lying on your back with your knees bent, feet on the yoga mat, the next yoga posture we're doing is called windshield wipers. So basically, you'll be taking a foot out to the side and just kind of noticing what's going on with the hip musculature. Now, those of us that are seated, one way we can do this is we bring that yoga block in front of us. When it comes up come up on the balls of the feet and drop a knee out to the side. Then everybody, you're going to take that other knee and drop it towards the first leg that went out to the side. So there's a little bit of a low lumbar twist here. And you may notice some of your side behind coming up off the yoga mat, twisting a little bit when you're doing this seated on the chair. And just notice what you notice. Sometimes it feels spicy, and you may have to take that yoga block if you're laying on your back and place it underneath the leg that's closest to the floor. If it feels a little kind of cranky, I guess you call it. And then from here, we're going to take that top leg, bring it back to the center, bottom leg back to the center, and just be here back into constructive rest pose. So constructive rest pose, lying on your back, on the bed, on the couch, helps to ease tension out of the spine when you're doing this lying on your back. Now we're going to do a windshield wiper on the other side. Again, I have my feet on the yoga block to allow for a little bit more range of motion while doing this seated on the chair. So drop that knee out to the side. So again, we're kind of working with that hip musculature when we drop the knee out to the side. You might have to have a yoga block underneath, but this again feels a little spicy in the body. And it just allows you to kind of rest your leg weight on the block. Now, totally optional, okay? Now we're going to do the other one. We're going to drop the other one towards the first one that we just dropped. And again, there's this little low lumbar twist. I'm taking my hands back behind me so I can have a tall posture when I do this seated on the chair. Again, I had a request for doing the class seated on the chair, standing behind the chair. So that's what we're doing today. If that doesn't resonate with you, you may want to look at one of my previous videos. Otherwise, you're welcome to kind of experiment with me today, okay? From here, we're going to take that top leg back to the center, bottom leg back to the center. From here, kind of wiggle those legs a little bit, and then stomp the feet. And again, wiggle the legs, stomp the feet. We're going to do that windshield wiper motion one more time. So drop the knee out to the side. Again, I'm hanging onto my chair to do this. I'm seated. And then drop the other one. So I'm twisting a little bit more on that second round is what I've noticed. Welcome to Back Care Yoga. My name is Gail. This is my 26th year to be teaching yoga. This is let me think here. 2019 is when I started teaching for Veterans Yoga Project. So way back then, however many years that is, what is that? 7 years? Yeah, 7 years. But I taught gratitude classes before that for fundraising for Veterans Yoga Project. And then bring the leg back to the center, then the other one, and then let's hang out on the other side. So drop the knee and move my foot a little bit, and then drop the other knee and just kind of hang out here just a little bit. If you're lying on your back, you can also take your head and look the opposite direction, if that feels okay. Otherwise, just keep the head aligned with the spine. You're kind of looking up at the sky here. All right, from here, bring that top leg back to the center, bottom leg back to the center. Move the block to the side. Keep it close, though. And then again, stomp the feet. And then shake the legs. And then grab your yoga strap. Find your yoga strap. Where did the yoga strap go? So we're going to do knee to chest pose. So seated, you can either do this one of two ways. Fingertips back behind the knee and bring the knee in and extend the leg out. But what I like to do when I'm seated is take that yoga strap. You can do this also lying on your back at the bottom of your foot. And then I grab that yoga strap and I'm away from the back of the chair so I can kind of lean back when I do this. So we're lubricating the knees, the hips. And we got the little ankle glide going on here with a soft flex of the foot. So let's inhale, knee into chest, and then exhale the leg out. Now the leg can be in the air or rest the back of the heel on the floor if you're seated. It's going to be whatever's comfortable for you today, okay? So again, these are postures for easing back pain. And you gotta keep on moving. So again, we're going to inhale, knee into chest, exhale, leg out. Coordinating the breath with the movement helps to lower cortisol. Breathe in, exhale out, which helps us to lower our stress hormone, okay, that cortisol. All right, again, inhaling knee in. There might be some snap, crackle, pops going on. Exhale, leg out. Let's do one more. Inhale, knee in. Keep it there. Bring your hands either on your shins or back behind the knee and point and flex the foot. A little bit of ankle articulation here, and that's to help us walk better. Also to prevent leg cramps when we're doing that calf pump, returning the blood flow back to the heart, lowering that blood glucose. And then make the foot nice and still. You may want to switch it hands back behind the knee if that's comfortable. I like the shin when I'm seated. And then again, sit up nice and tall, kind of poof your chest a little bit. And then we're going to make a little foot circle inward. Make it the tiniest circle you can manage. So that's fine motor control with those tiny circles. You might feel a little kind of jaggedy thing going on with that circle. And then make it a medium circle. Oof, I can feel the outside of the ankle really kind of tight today, yeah? And then make it a big circle. And then relax the foot, kind of shake the foot a little bit, shake, shake, shake. And then we're gonna do the other direction. So we're gonna make the circle go outward, tiny, tiny to begin with. And then go to the medium size. And then the big size. And then release that foot down to the floor. Let's once again kind of stomp it out. We're kind of letting go of that muscle memory, getting into the hips, getting into the knees, little density bouncing here. And then up on the balls of the feet or flat feet if you're on back, and shake those legs. Shake, shake, shake. And one more, kind of little stomping, marching in place. Bone density builder. And release. Now we're going to go over to the other side. So you're going to bring your yoga strap along the bottom of the foot of the other leg. Again, using the strap is optional. Again, I'm at the edge of my chair to kind of help me to lean back when I bring the knee into the chest. And again, we're trying to increase mobility in the knee and the hip joint and encourage that ankle glide with a soft flex of the foot. So I like to explain, benefits of poses. So here we go. Got my hand grip going on here and belly button tight, and inhale, knee into chest. And then exhale, leg out. If you're seated, you can do the leg in the air or rest the back of the heel on the floor. You'll get a good calf contraction. And keep on moving. Keep on breathing. Inhaling and exhaling. And again, I'm trying to coordinate the breath with my movement. Breathe in. Breathe out. If you get mixed up on the breath, that's okay. Just keep breathing, okay? Just keep breathing. Woo. Now my foot kind of turns out to the side on this one. That's what I notice. It's not like straight up and down because this is my very, very tightly held side. And I can kind of feel my knee, my meniscuses going crinkle, crinkle. It is what it is, okay? Let's do two more. Two more. Breathe in. Exhaling, leg out. One more. Breathe in. And then if you can, grab your shins or back behind the knee pit and let's point and flex that foot. Or in my case, I get little ankle pops on this side. Yeah, I can kind of, and my tendons kind of move around a little bit. I can feel that on the top of the foot. It's a kind of a weird feeling, folks. Or at least it is to me. All right. And then from here, I'm going to put my foot back down and kind of wipe the sweat off my hands because my sweat's accumulating. Go back. Okay. I just had to do that. And then from here, I'm going to look at my foot and I'm going to do circles, tiny, tiny, in towards the center. And again, you might notice some tightness on the outside of the ankle. You might notice some snap, crackle, pops happening. Make it the medium size. And then as big as you can. This one's kind of jaggedy on this side. So this one's very stiff compared to my other side. So you'll kind of have increased body awareness, especially if you're doing a back yoga class. One side feels different than the other. Upper, lower body, right versus left. All right, and then make everything still. And then we're going to draw the circle outward tiny first. Oof. And again, my circle is not a circle. It's like an amoeba. It's an amoeba. An irregular shape, and then make it medium. The one thing I remember from biology, amoeba. Okay, well, maybe I remember some more things than that, but right now that's what's coming to my mind. And a big, big, big circular shape. Woo! And then release it. Release it to the floor. Again, shake, stomp those feet. Bone building, love it. And then shake the legs. And then we're going to try to do this. I don't know how it's going to work on your back. We're going to clap the hands. Oh, do that again. And then get some heat here. I'm here at the thumb beds of my palms, and I'm moving it into the palms and down into the fingers. Now, since I'm seated, I can hinge forward, but those of you on your back, bring one of your knees in towards your chest and get that heat on your kneecap. So again, you're doing this however you can, whether you're on your back, on the bed, on the chair, on the couch, and then reverse it. All right, now, if it's available, tap, tap, tap on the inside and the outside of that same leg. That's for lessening knee pain. Now, we're going to take the fingers back behind the knee and then scrub, rub back behind the knee. Again, you got to be a little talented doing this on your back. You got to bring that knee into the chest. And your side or your thumbs are rubbing on the side of the knees, rubbing the meniscuses. All right, very good. And then release that leg down to the floor. Just a little shake here, a little wiggle of the legs. Sit up tall if you're seated. And then let's clap the hands once again. Do that again. All right, rub some heat into the thumb beds. Again, today's class is done seated from the chair. It's a little different than what we normally do. I usually do the verbal cues for the chair, but today we're switching it up. All right, on to the other knee. So since I'm seated, I'm hinging forward, but those of you lying on your back, bring that knee into the chest to where your hands can reach your knee. Again, you're being sweet, you're being not spicy with this, okay? Sweet, not spicy. And then let's tap, tap, tap. Again, that's for lessening knee pain. It's a gallbladder, stomach meridian. And then again, knee into the chest. You can take those fingers back behind the knee and rub that knee pit. That's for lessening edema, swelling in the legs. Very good. All right, from here, let me think here. We're going to do what's called notice pose. We're going to extend one leg all the way down to the edge of the yoga mat, rest the back of the heel on the floor, and then the other. So for those of you that are lying on your back, you're noticing, how this feels for your backside. For those of us seated on the chair, it just feels kind of awkward, and that's okay. And then those of us seated on the chair, point the toes away. So it was like a very, active calf constriction or contraction, I should say. And again, toes towards you if you're seated. And release. Very good. All right, so we did windshield wipers, we did constructive rest pose, we did knee to chest. Let's do big toe hold for bone building. So to do that, grab your yoga strap, whether you're lying on your back, whether you're seated on the chair, and find that middle spot and place it once again down underneath the foot and extend the leg straight out into the air. And then those of us seated, rest on the back of the heel. So to make this bone building, you have your toes aligned with your shin, your knee. It's not out to the side any. And then you're going to grab your strap and pull on that strap and then very vigorously push the foot away. So you feel that whole leg contraction. If it's spicy, maybe back off a little bit. Now, if this is too much for your hands gripping that yoga strap, bring your hands up the strap and wrap your wrists and then re-engage. Pull, push. You got to hold it about 30 seconds. Now, what I'm doing is bringing my arms to the outside of my ribs and then kind of poofing my chest forward to have a tall spine as I'm doing this, whether I'm laying on my back or seated. So seated, it's easier to bring the arms beside your ribs, but your arms may be up and away if you're doing this lying on your back. So again, this is one of the 12 yoga postures, big toe hold with the yoga strap for building bones, for easing osteopenia, osteoporosis. Might feel spicy in the back of the leg. You might want to bend the knee just a bit, but you're still vigorously toes towards you. Woo! And your hands are probably going, hello. This also helps increase your grip strength, which as we get more vintage, that's one of the factors that they check. How are you still able to grip very, very well? Opening those jars, or do you need assistance? It's okay to need assistance, but is it declining? And so here we are building our grip strength also. And release. Woo! Shake that leg a little bit. Rub those hands, because it's like, whoa, the grip of the strap is kind of like, makes my fingers feel all stoved up. Yeah. All right, same leg. We're going to do big toe hold, leg out to the side. So again, you get the setup, you grab the strap, and you're going to drop the leg out to the side. Those of us seated, we're making like a little, an angel with our leg. Does that make sense? An angel wing. Again, you're pulling, you're pushing, and I've got most of my torso facing the front. So I'm not turned towards the leg. I'm here towards the front of the room. Woo! You might be feeling that calf just a little bit. Are you pulling and pushing vigorously? That's my question to you. Are your toes pointing up towards the sky? Do you need to bend that knee a little bit? I need to bend the knee just a little bit, not much. Again, pulling and pushing. Also, you can bring the hands up the strap, wrap the wrist, re-engage to get that nice muscular contraction. Again, you got to hold the posture at least 30 seconds to a minute, 12 seconds to get the bone building benefit. BBB. Woo! And don't forget to breathe. Oh yeah, let's breathe. Again, this is called big toe hold with strap to the front and strap leg out to the side. So we kind of get into the different angles here in that hip musculature with this posture. And release. Yay. Release the strap. Clap the hands. Get a little circulation going back into those hands. That's an important thing. Maybe the back of the hands also, because it's the grip. We're doing the grip. All right, grab your yoga strap. Other side. You probably thought I forgot to do the other side. You were probably wishing I forgot to do the other side. I didn't forget. Again, leg in the air, flex that heel, toes aligned with the shin, the knee, and just don't let it hang out there. You got to pull and push. Now, what I'm going to do with that other leg is bring it out to the side a little bit to kind of have it be, more stable for seated. But if it's more together, I feel like a little kind of wobbly. So again, I'm going to bring that leg out to the side. Woo! So hello. So you're noticing, how does this one feel compared to the other? Am I able to push as much as I was on the other side? Does the muscles feel different when holding big toe hold? It might. Because if you're here for this class because it's for back care, typically you're going to find differences one side versus the other. And just, know that that might be what's going on. Depending on, what your back challenges are. Maybe it's scoliosis, maybe it's sciatica, maybe it's stenosis, all those S words. Maybe it's disc degeneration. What's the other ones? Bulging discs, reticulolisthesis. Man, there's lots of diagnoses going on here. Maybe it's kyphosis, lordosis, excessive curvature of the spine in the low back and the upper neck, those kind of things, yeah? And release, yay. Again, let's get those hands feeling better. We need to do that in between holding this vigorously. All right, now we're going to do the last part. So again, strap along the bottom of the foot and then bring your leg out to the side. If you need to use that leg out to the other leg out to the side as a counterbalance, please do so. And our torso facing the front of the room if you're seated. It just naturally happens if you're lying on your back. Now you're going to pull, push into that strap. If you're feeling especially spicy, you can do two things. You can return your attention to your breath. So listen to the breath going in through the nose. Here we go. And as you listen to it, as it exits your nostril tips. Sometimes that allows you to stay in the pose. Sometimes, nope, you need to bend that knee. Maybe do less vigor in the posture. Again, you can kind of play around with that, okay? Again, pulling and pushing, the grip strength going on here too. Keep breathing. Just keep on breathing. Keep on breathing. Oh, yeah. Woo! And release. Yay! Release the strap. Yay. Clap the hands. From here, if you're lying on your back, your hands are going to be in front of you. Those of us seated, hands out to the side, we're basically going to make fists and fingers out. So just kind of get some circulation going on with the hands. Little hand arthritis hand exercises here. All right, and then we're going to take the thumb on top of the finger and finger flick. So flick a mosquito away. Yeah. There was a new bug that's out there that's eating the wounds in the cattle and the deer, the screwworm, I think it is. So I'm flicking that screwworm away. Not that I would be close to one, but I'm just imagining that, okay? Y'all are going, what? And then one more. And then softly clap the hands. Now let's do a soft rubbing of the thumb beds, of the palms, of the fingers. Next is going to be piriformis bounce in reclined pigeon or seated pigeon posture. So you'll need your yoga block, you'll need your strap. So those of us sitting, you're going to either cross the ankle at the ankle bone. And if you're lying down, you're lying on your back, knees bent. So this may be your posture. If you're doing ankle on top of the ankle, you may need to thread your strap underneath the bend of the knee, because basically you're letting that leg kind of move a little bit. Now, some folks have a little bit of flexibility and they're able to bring the top leg on top of the thigh. So if you're seated, there's kind of a constriction going on here. You basically pull it up and let it release. If you're lying on your back, you can take your yoga block and bounce it away. Sitting here, you don't have much range of motion bouncing it away, but seated, pulling it up and letting it drop allows you to go for a little bit more range of motion. And again, so we do the piriformis bounce to warm up that muscle where sometimes that sciatica is in or on the side or in a pelvic notch. So we're just kind of letting that nerve get unnervy, so to speak, if that makes any sense. So again, the piriformis bounce. All right, and then we're going to make everything still. We're going to take that bottom foot. We're going to tap, tap, tap that bottom foot. So tap, 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 and then press the bottom foot firmly into the floor. So you feel this little contraction energy going on. Whether you're laying on your back or here in the chair, you're going to take the top toes, point them towards the knee, sit up tall if you're doing this seated. And then for those of you laying on your back, you're squeezing both bones, press that leg away. If you're seated, hands on the foot, hands on the shin, knee, sit up tall and hinge forward. Woo! It might get spicy in that behind, okay? Again, press into the bottom foot, toes towards your knee, activate that calf, press into that top leg, press it away, whether you're seated or hinge forward. You don't have to hinge too much to feel this seated in this pose. So again, here's your pigeon posture. I like this seated on the chair. I like this laying on the back even better, because you can kind of really get into what's going on here with those of us that might have some sciatica challenges. Yeah, the shooty pain down the leg, the numbness, it might move one up the leg and over to the other side, depending where that nerve is getting pinched or getting entrapped. And then release, bounce, relax the leg. So I've got a little bit more range of motion seated after doing that. And then bring it back. We're going to go back to shaking the legs, stomping the feet. Very good. Let's do the other side. Again, one leg may be able to come up on the thigh versus the other. Maybe, maybe not. And again, I'm going to show the leg out to the side version today on the other side. Again, if it's here on the top of the thigh, you're pushing it away or pulling it towards you if you seat it. With the strap, I'm hanging onto the back of the chair, and I'm just doing that little range of motion change here. That little bounce, that piriformis bounce. Again, that's to warm up that muscle before we work it out. Work it out. We're going to work it. Depending where your behind's sitting on the chair too, you may want to move your behind, make it more comfortable. That's always a challenge, right? All right, and then we're going to make everything still. Then I'm going to tap, tap, tap that bottom foot and then press vigorously into that bottom foot. So I feel that contraction energy going on. Top toes, point them towards your shin, whether it's out to the side, on top of the thigh. Sit up tall if you're doing this seated. And then from here, squeeze both buns, okay? And again, if you're laying on your back, you're going to press that leg away or use your hand to press it away. If you're seated, sit up tall, hinge forward. Now, across at the ankle, you may find yourself coming more forward than you were if the leg were on top. Just notice what you notice. Toes towards your knee, calf contracted, bottom foot firmly into the floor, squeeze buns. So a lot of contraction energy going on here. We hold it a little bit. We breathe. Don't forget to breathe. Again, I'm showing the ankle on the ankle variation for the second side. Woo! And release. Shake that leg. Do that little reverse piriformis bounce, I guess you call it. And then bring the leg up and off. Shake the legs. Stomp the feet. Beautiful. Okay. From here, very slowly, if you're lying on your back, let's roll over onto your shoulder, onto your side. Sorry, I don't know what I'm talking about. And then roll up to where you're up to a seated place. Okay. So sometimes what I'll do is I'll take a yoga blanket and I'll sit on the edge if I'm sitting on the floor. You can do this seated on the floor or on a chair. You can also do this standing. So we're going to do some of our 6 essential spinal movements in this particular position. So I have my feet, my legs at a 90-degree angle. They're not like far out or really close in when we do this. Then I'm seated here at the kind of the edge of the chair. From here, let's do, what are we going to do first? Let's do unsupported twist. So we're going to squeeze. So, arms to a letter T and then bring the elbows in to where you feel that upper back musculature contracting. Now my feet are a little wider than my hip distance apart. So I have a good basis stance here. And then from here, as we did before, we're going to breathe in, expand the belly. Now with the chin aligned with the chest, we're turning towards one side. So we're letting the thoracic spine, that mid spine, do the work. This is called an unsupported twist. Now sometimes what happens, people's knees go in or out. Try to keep them the same, whether you're lying on your back, seated on the floor, or on the chair, not lying on your back. We're doing this seated. And then let's bring it back to the center and release. Let's kind of shrug those shoulders up, back behind us and down. So very contracted upper body when we do this. And then let's reverse that. Reverse the shoulder rotation. You might notice one side more spicy than the other. All right. So supported twist is where you take a hand to the outside of the leg and twist. So that's forcing a twist because sometimes you're thinking, oh, I need to twist more. For those of us with back challenges, that's not necessarily a nice thing to do for your body. Go back to letter W, upper body contraction going on here. Again, strengthening the upper body with this letter W. And then again, breathe in, belly big. And then let's go over to the other side. You might be twisting more one side versus the other. And again, try to think about what your leg's doing too. Woo! From here, breathe in, belly big. Exhale, release it back to the center. Now from this time, we're going to do what they call the shoulder shuffle. That's also to encourage lymphatic drainage. So up and down, alternating up and down. So this kind of moves the lymphatic fluids here at the collarbone into that thoracic outlet on that left side. And then let's just kind of complete it with taking the hands spread out, bring it in front and back of the ear, stroke it down the side of the neck and the side of the jawline to encourage lymphatic fluids to come out of the brain, so to speak, cerebral spinal fluid flow. Very good. Let's do the other side. Spread out the hands, go on the side of the neck and down the jawline in front and in back of the ear. But when you go to the doctor and you're sick, they're always like palpitating, your lymph nodes. Are they swollen? So this is one way every day to kind of keep the lymphatic fluids moving out of the body. You can only do that with movement, all right? Very good. From here, kind of shake the hands, shake it up, turn it side to side, whatever your body allows at this moment. Maybe one side twists more than the other, more easily, maybe not. And then bring it here to a letter T, palms down. This helps with carpal tunnel. And then turn it wrists up and flap those wrists also. Got a little Tai Chi going on here. We'll kind of mix it together. And then from here, let's spin the wrists. Again, you're noticing the mobility. Is one wrist able to spin easier than the other? I really don't notice it when we do this initially, but then we pause and then reverse. So I notice that left arm is more stiff than the right. My non-dominant is more stiff. That's what I notice. And then there's a little air coming across the neck, which is a bonus, right? And release. Now for this one, you can be on your hands and knees, you can be standing, you can be seated. We're going to do cat-cow. So that's extension and flexion of the spine. I'm gonna cue from the chair though today. And from here, what we try to do when we're in cat-cow, we keep the head neutral in back yoga. We don't take the chin towards the sky when we do cow, where the belly is more towards the floor. We don't tuck the chin in towards the chest when we do cat. When we're doing back yoga. Now, of course, I don't see anybody on their videos, but I'm just cueing what is the more safe version to do. So from here, we're sitting up tall. My hands are on my shins, my knees. We're going to breathe in, belly big. And then from here, we're going to curve our spine to the top of the room or the back of the chair. Now keep your head aligned with the top of the shoulder. So we're not looking down towards the chest, okay? From here, belly big, breathe in. And then exhale back to neutral spine, nice and tall. So that's a big pelvic tilt that's happening there. So just kind of notice how this feels in your body. Now we're going to go into forward fold or cow pose. First, we breathe in and then exhale, belly button tight, hinge forward or drop the belly. Again, we don't bring the head towards the ceiling, okay? We keep it all nice and aligned. From here, breathe in, belly big. Contract the belly, go back to neutral spine or tall seated mountain is what we like to call it. Very good. We're going to do that a couple more times to get that kind of curvature going with the back. Breathe in, belly big first. Exhale, curve the spine. Keep your eyes gazing forward or looking, straight at the floor. We're not tucking that chin in. Very good. Breathe in, belly big. Belly button tight as you come out of that curved spine to neutral spine or seated mountain pose or neutral spine. Again, breathe in, belly big, staying here. Exhale, hinge forward or belly towards the floor for your cow version of the pose. Staying here, belly big. Contract the belly button towards the spine. Come back to neutral spine. Very nice. Okay, from here, if it's available, you can kind of wriggle your hips side to side. Those of us seated, turn your shoulders side to side just to kind of let go some of that energy that might have built up in our cat-cow. And then we're going to do oppositional reach. So for those of you on your hands and knees, you're going to extend one leg out, your toes on the yoga mat, and you're kind of, looking at your hands are underneath your shoulders, and then you're going to bring your opposite hand outwards. Now, those of us seated, what we're going to do is firmly have our behind in the chair. Take your hand underneath your knee pit, lift your foot up, flex that foot, lean back a little bit. Then you take your opposite arm up. Then if you can, hand on top of the leg, release the leg. If that's not available, hand underneath the knee pit, and then poof your chest for activating that multifidi. Lift the foot off the floor, extend the arm for that oppositional reach, and release. Woo! We kind of held it a little bit with that explanation. We're going to try to do the same thing. But you know what? Wriggle side to side, shake those hips, shake those shoulders if you're seated. Just get a little bit of movement going on there because we're going to re-engage the other side. So extend the other leg, get it ready. Bring the hand underneath the knee pit, lift that foot, flex that foot, lean back so you feel the low abdominals activated. Now, extend that opposite arm up towards your ear if you can, and maybe bent. And if it's available, hand releases, press on the top of the leg softly. Sit up tall. And then you're kind of leaned back here for oppositional reach and release. Woo! And again, shake the shoulders, shake the hips. Now we're going to try to coordinate that with the breath. This may be mission impossible, but we're going to try it, okay? So what we're going to do, we got to think about this, right? Hand getting ready underneath the knee pit, right? And then sitting up tall. So we're going to extend an arm up, breathe in, belly button tight, exhale, lift the leg, extend the opposite leg. Inhale, bring the arm back on down. Exhale, release the leg back underneath your hips. Okay, we're going to try the other side. So here we go. Inhale, opposite arm up. Exhale, hand underneath. Extend that opposite leg. Lean back, belly button tight. Release the arm down. Release the leg down. Woo! While we're here, do a cat. Curve your spine to the top of the room, to the back of the chair. Come out of that with a neutral spine, and then hinge forward, belly down for cow. Very nice. Go back to neutral spine. Go back to cat posture. Curve the spine to the back of the room. Very good. Back to neutral spine, and then hinge forward for cow. Wonderful. Okay, now we're going to come to standing or seated on the chair. We're going to do our warrior postures. Again, I'm doing them seated today. So if you're doing these today and you're using the chair, stand behind your chair. Let's see, I don't think I'm going to use my yoga block. I don't think I'm going to use that yoga block. And then seated, I'm scooching over to one side of my chair. If you're standing, you step your feet wide, hands on the chair if you so choose. I'm going to take the leg, step it out, and I'm scooting my booty back a little bit here. So for this, those of us seated, we naturally turn towards the center. The objective here is to turn your torso towards the front leg. So you get a little twist going on here too. Now to make this vigorous, we push those heels firmly into the floor, whether you're standing, whether you're seated. For those of us standing, take one foot and point it towards the short end of the yoga mat. All right, so this is kind of hard because my foot's going slippity-doo here. But again, I'm feeling contraction energy in my thighs. Press down, press away. So you're smoothing out a wrinkle. Then we're going to go back to letter W with the shoulders and then extend those arms out into a letter T. Here's your option. You can take your head and look towards the side where you stepped out the leg or where you turn the foot. For warrior two, contracting those shoulders a little bit. And we're going to do side lateral flexion while we're here. So release the arms down. You're still vigorously pressing into the feet. Take your hand on that thigh and the other palm up, and then bend the elbow, bringing the arm up and over for that side lateral flexion. So the knee is bent and your hand on the leg, arm coming up and over if you're doing this standing. It may look different than what I'm doing. Just know that, okay? Your thighs may be burning by now. All right, you're going to take that top hand, bring it onto your hip, bring the other arm, palm up, and bring it up and over. Now, you hang onto the chair if you're doing this seated. Hang onto the chair if you need to, if you're doing this standing, or hand on the hip. And then release that. Woo! Bring everything back to the center, walk it in. Stomp your feet, shake the legs. Now we got to do the other side. Of course we do, right? So we're going to step the leg out, feet wide, turn the toes towards the short end of the yoga mat. Press your feet firmly into the floor, like vigorously, like you feel those quadriceps contracted, you feel those calves tightening. You're stimulating the bottoms of the feet, those acupressure points. Turn your torso to the front. Very good. Squeeze these shoulders. Here we go. Woo! Now, firm feet into the floor. Fingertips on the chair if you need to, arms out into a letter T. Now, don't forget, firm feet into the floor to make this very, very, very active. Don't forget to breathe. We stay in the pose a little bit. Now we're going to move this into side lateral flexion. Hand on the leg, palm up, and then bring the arm up and over, whatever you can manage. Again, it's a bent knee. You're doing this standing. Keep breathing. Now I'm going to bring my hand, top hand, to my hip or the chair in my case, and do a palm up with the other one. So we got to reverse that. Reverse warrior. Feet firm into the floor. Again, it may look totally different standing. It may be more arcing. It may be less arcing. Feet firm into the ground to where you're feeling that lactic acid building up. Woo! And release. Yay. So we're going to bring the foot in, bring those feet in, stomp those feet, shake those legs, stomp the feet again. All right, let's do tree pose. So again, tree pose is interesting, seated on the chair. You're going to grab your yoga block and have your ball of the foot be on the chair. No, ball of the foot on the yoga block and your heel lifted. So those of you standing, step a foot out, lift the heel, turn a foot out. You're going to bring your leg either next to the ankle or up on the calf. or above the thigh. Those of us standing, you bring that, you come up on the balls of the toes, knee out. It might be available to where you can do the arms out or one arm, but you're very vigorous with your feet into the floor. And again, there may be a swaying tree happening here. So again, we're getting into the musculature when we bring that leg out. So those are you standing, maybe ankle to ankle, maybe ankle, foot on the calf, or a little bit below the knee or above the knee, not the knee joint though, okay? And release. Woo! We're gonna go back, kind of shake the legs, stomp the feet a little bit, go over to the other side. So you're gonna step the other foot out, lift the heel, turn the foot out to the side, start bringing it in if you're standing, ball the foot on the yoga block, heel lifted, turn the foot out to the side at your edge of your chair. And then from here, firm feet, whether you're standing, whether you're seated. Maybe you can do the squeezy shoulders. Maybe you can bring it more. Maybe you have fingertips on the chair, one or two arms out. You get to choose, but you're going to feel this in your hip musculature and the hip bones, contracted thighs, contracted calves, firm feet into the floor. Squeezy shoulders is an option, or one squeezy shoulder. That's always an option. And release. Woo! All right. Again, shoulder shuffle, side to side movement. Very good. For those of you that are standing behind the chair, let's come on back on down to the floor. We're going to do block bridge. And let's see, do I have a, I'm gonna see if I can do that here. I have 2 yoga blocks. I always talk about how this one doesn't resonate well on the chair. It does not resonate well. So I'm taking 2 yoga blocks, making them tall. And so basically, when you're laying down on the yoga mat, you're going to put your behind on the yoga blocks, okay? And your knees are bent and all that. You may have to kind of move your shoulders a little bit. And then I'm going to try to press my low behind into the blocks. I don't have an open back on this chair. All right, from here, those of you lying on the ground, I invite you to lift one leg and shake that leg. Seated, hang onto the chair, shake the leg, press the low behind into the yoga mat, into the yoga block. Now shake it side to side. You can go over to the couch and do this. This is like a wonderful yoga posture. You're not able to get down to the floor and do this. And release. So you may notice some tingling, some sensation happening, going on here. Again, this is called block bridge. This is for easing tension further and some more out of the spine. All right, so let's do the other side. So shake the leg. My chair's squeaking. And shake it side to side. Can't quite shake this one. I'll do the best I can. And then maybe you can do both at the same time. I don't know if I can. I'm gonna hang on to my chair, see if I can do that. I can't do that. Oh yeah, okay, there you go. And shake it side to side. All right, bring one leg down, then the other. Take that block out if you're lying on your back. And then take the blocks out here. Now for sitting in the chair, you're not going to feel this like instantaneously release of the spine. So this is kind of like a very like wonderful yoga posture. It's a reason for having 2 blocks or 1 block. And then for those of us on the chair, scoot back. Those of us lying on the yoga mat, let's extend one leg out, then the other. Relax. Notice what you notice. Now at this point in class, you can take a little towel and cover up your eyes, or take your yoga strap, cover up your eyes. You can put your legs on the chair, legs on the wall. It's our guided rest and relaxation practice. So I'm going to come up more close to the front of the room for this guided rest practice. And do what's called a non-sleep deep rest meditation. It's kind of like a yoga nidra, but it's a very short. We do a body scan. We compare the front side and the back side of the body. And then we do what's called an elongated breath. So that's what's coming up next with our guided rest and relaxation. So I invite you to get comfortable. Maybe you're going to go over to a soft couch or a chair. Maybe you're covering up with that yoga blanket or that big long towel. So whatever's going to make you feel a little bit more comfortable. Now, Miss Vicky, she's put her legs on the chair. That's also a wonderful thing for easing tension out of the spine. You can kind of move the behind away a little bit, and there's this little kind of traction pulling energy when you have the legs on the chair. So let's just set our thoughts to the side for a moment and just notice the breath. Notice the chest and the belly rising as you breathe in and sinking as you exhale. Let that breath just kind of wave, kind of come over you. Again, breathe in, belly big, and exhaling. From here, let's do that body scan. So from the top of the head, we're going to travel down to, we're going to start with the right hand thumb. So you're going to say in your brain, right hand thumb, you'll imagine it, and you'll focus and bring all of your attention to that right hand thumb, whether your eyes are closed or open. All right, so here we go. Right hand thumb, index finger, middle finger, ring finger, right hand, pinky finger, palm of the right hand, wrist, forearm, right elbow, upper arm, right shoulder. Let's bring all of our attention, all of our awareness to our right side chest, right hip, groin, upper right leg, knee, shin, top of the right foot, right big toe, second toe, third toe, fourth toe, and that right pinky toe. Shifting all of your attention, all of your awareness into the sole of the right foot, ankle, right calf, back of the right knee, back side of the upper right leg. Good. Let's shift our attention from the right side of the body over to the left side of the body, starting with that left thumb, index finger, middle finger, ring finger, left pinky finger, left palm, wrist, forearm, left elbow, upper arm, left shoulder, left side chest, left side waist and hip, upper left leg, knee, shin, top of the left foot, left big toe, second toe, third toe, fourth toe, left pinky toe, sole of the left foot, calf, back of the left knee, upper left leg. And then from here, notice the left side of the body, then the right side of the body, and then go back to the left side of the body. And once again, the right side of the body. Let's together notice both the right and the left together at the same time. Good. Let's shift our attention now from the front places of the body to the back places of the body, noticing the top of the head, the back of the head, the right shoulder, left shoulder, the back side of the left ribs, the back side of the right ribs, right behind, left behind, back side of the right leg, back side of the left leg. the back side of the right arm, the back side of the left arm. From here, let's notice that sensation of support. It may be the behind, the back, the feet. It may be the back of the head, shoulders, the backside length of the body. So notice that sensation of support, feeling very weighted, very heavy in being supported by the surface beneath you. So notice that. And then when we flip that to the front places in the body, notice the air coming across the palms, the arms, the neck, the face, maybe the feet. Notice that the arms are light, the legs are light. The whole front side of the body feeling kind of light and feathery. Now contrast that to the places in the back side of the body, feeling weighted, feeling heavy. And then noticing the places in the front side of the body feeling light, feeling feathery. Notice feeling weighted, feeling grounded, and light and feathery at the same time. Good. Let's come back to the breath. Don't change it right now but just kind of notice it. Just notice, is it a shallow breath? Is it a low belly breath? Just notice what you notice. And then from here, if you're lying on your back, if your legs are on the chair, if you're on the couch, just kind of wiggle your fingers, wiggle your feet, whether you're seated, whether you're laying on your back. And if you're lying on your back, go ahead and roll over onto your side. If you're seated in the chair, come away from the back of the chair, come forward a little bit. If you're lying on your back, take your time, roll over onto your side, come up to that tall seated place. Once everybody is up tall, seated, drop your chin towards your chest because that will calm down any equilibrium shifts here. That's a little stretch for the upper back there just for a moment. And then raise your chin to gaze forward because now we'll do that elongated breath. So that helps us to lower our blood pressure, lessen the heart rate. So basically what's going to happen, I'm going to clap my hands 4 times. You'll breathe in during that 4-handed clap. We'll pause and then we'll exhale to a count of 5. So again, we make the exhale a little longer than the inhale. If you're not able to do that breath, you know what? Just breathe. So here we go. Breathe in. And then slowly breathe out. Again, breathe in, expand the belly if you can. And slowly breathe out. One more time. Breathe in, belly big. Slowly breathe out. Good. Now let's transition into our gratitude practice. What we typically do is bring our hands to heart center. You can stack them or hands together or make it feel comfortable, however that is. And we drop our chin towards our chest softly. And gratitude just showing up today. Let's think about one thing that we're grateful for, or at least an idea of gratitude. Let's grab it, clasp it, and place it into our heart space just for a moment here. So I appreciate y'all's dedication, discipline, determination, and responsibility for coming to class, signing up for a class, maybe watching a recording that shows that you are wanting to get on that path of self-healing. I love it. Thank you for showing up for yourself today. And then from here, let's gaze our eyes forward as we end our class in a traditional way. So the light in me honors and respects the light in you. So let's take that peace, the strength, and that understanding, and that little attitude of gratitude, and let's pass it on. Namaste, which means the bright light in me honors and respects the bright light in you. This concludes our practice of gentle yoga today on the chair, and hopefully you'll join me next week for chair Tai Chi. Let me stop the recording.